Welcome to Gas, the true story of a toxic train derailment. I'm Ron Scholl. Last time on Gas, officials disclosed that chlorinated chemicals were created in the mixing of chlorine and the potassium cresslate. The unwelcome news added a new layer of concern for spill victims worried about their health and safety, even as chlorine continued to leak. We now continue with Part 1 and Chapter 22, Criteria. Friday, April 19. The Missoula Health Department and the EPA worked together on the reentry plan, and Steve Way would give approval to Waldron when criteria were met. Way was now a de facto Unified Command member. Waldron said at an IC briefing on reentry that Car 3 must have all product offloaded and the environment had to be safe. The health department goals for reentry included, quote, smell identified, chemicals identified, soil, water, air monitoring, including household monitor. Leahy had listed identification of the smell as a goal. Yeah, we did, Leahy recalled, before backpedaling. I wouldn't say we wanted the sampling identified. We wanted the sampling done for the chlorophenols to see if it migrated. So I wouldn't characterize it as we want to know what the smell is. We were concerned, regardless of smell, of chlorinated compounds. But Leahy had said to evacuees this very day, we wanted to find the answer to the question as to, first of all, what is out there that is irritating people? And secondly, what are you smelling? Thirdly, are there chlorinated compounds? What people smelled and reacted to had driven the investigation. Leahy, when we've established that there are chlorinated compounds, and even before that we know that there's a smell, and then that smell lingering, Leahy hesitated. I can't say that they're reacting to the smell, but it would be very believable to me that they're reacting to the smell. It's also possible that in addition to that or separate from that, particularly with some of the earlier reentries and visits, that there's a stress reaction, which is also a very valid reaction. There could be a combination. Leahy believed people's complaints upon visiting the exclusion zone could possibly be explained by exposure to cresslate-related chemicals. To smell something like that and have a headache, that's totally believable to me, she said. But many visitors suffered more than headaches. Today, health officials met for a preliminary meeting on reentry plans. It was undocumented except for Leahy's notes. Leahy noted per Deputy County Attorney Mike Zahasted that an emergency was any condition that continues to keep people from returning. Zahasted served as the counsel to the incident command team simply because we have to know where we stand legally in terms of emergency authority and ability to sustain an evacuation, Leahy said. Leahy had noted, objective, is it safe to go in? And hypersensitization, is it a criteria? And individualized, not much known, not hyper, just sensitized due to injury. The officials had pondered, should sensitivity be a criterion for consideration? Leahy noted, chlorine sensitivity, delayed, can be triggered by other chemicals, could be cresol hypersensitivity. That is, chlorine injury could cause sensitivity to other chemicals. Leahy recalled that people who are injured, if they got exposed to smells afterwards, that's all happening on injured mucous membranes. And so it's like going out into the sun after a sunburn. And so there was definitely some heightened sensitivity because of the previous injury. Leahy now knew per Garen Smith that 2 to 3 drops of cresslate could fill a room. Did she recall anyone speculate how far the smell from 17,000 gallons might drift? I don't remember that it was 17,000 gallons, she said. Like many officials, Leahy had been poorly informed on how much had spilled. What sticks in my memory was that enough spilled that there could have been mixing, she said. There was potentially a lot of odor in the Alberton area for people to be sensitized to. Saturday, April 20. At the noon IC Plans meeting, the health department continued the conversation on reentry criteria. Concerning any chlorinated compounds that might have migrated, Leahy said, if the levels we receive are high or low, there is no problem. If the levels are in between, we have a problem. In other words, if contamination levels off-site were high or low, the action was clear, cleanup or no cleanup. If levels were moderate, the plan would be less cut and dry. Leahy, it is the consensus that the compound is a heavy mass and did not migrate far from the site. Chlorinated compounds remain close to the site. With no test results yet, This consensus was preliminary, based on understanding of the chemical properties involved. Leahy continued, the spoke-like testing also includes a concentric circle. People won't think they are lost between the spokes, but sampling could be truncated depending on early results. Leahy, we need to determine the criteria for allowing the reentry. A 9 a.m. meeting of public health minds was scheduled for April 21. Amid conferring with health officials and doctors, Leahy noted organophenols, then crossed the word out, underlining odor can cause headaches and nausea and vomiting. Dr. Leda Koken had just informed Leahy of organophenol odor symptoms in his poison control bulletin, as well as that phenols and chlorophenols smelled, quote, pesticide-like. Leahy recalled a lot of discussion about headaches and spill chemicals, since the odor itself can cause a headache, she said. But she further noted hypersensitivity, dermal, ocular, respiratory irritation. Leahy had wondered yesterday if sensitivity should be a criterion for keeping people out. She received further advice from County Attorney Sehested, noting, we cannot legally sustain an emergency based on some hypersensitivity. Yet, Leahy understood sensitivity could trigger skin, eye, and respiratory symptoms, headaches, nausea, and vomiting, and that chemicals other than chlorine could be triggers once sensitivity was established. Notably, while Leahy noted sensitivity and specific symptoms associated with odors during visits, at this same time, she helped ATSDR create their health survey, informing them of symptoms. Yet, ATSDR would make no mention of sensitivity per se in their survey. ATSDR did note that people reported various symptoms during visits, but made no mention of odors in their report. Now Leahy understood officials could not sustain the state of emergency based on hypersensitivity and these many symptoms. What did this mean for chemically sensitized people returning to Alberton? By now, Leahy recalled, she understood there was both acute and chronic hypersensitivity. Those that are still in the acute phases of the injury, she said, would be sensitive to chlorine if they were exposed to it again. Like sunburn on top of sunburn, as she would say. But Leahy said Dr. Rick Dart, a medical toxicologist with Poison Control Center, told her there will be people that can go on to have a hypersensitivity forever, to certain chemicals, to certain substances. Chris Weiss also advised Leahy on the issue, but he had mentioned publicly only 6 to 8 weeks of sensitivity. Leahy had noted sensitivity can be triggered by other chemicals. She recalled being concerned people might have sensitivity to chlorine, to chemicals related to the cresslate, or to other chemicals in general. Both acute sensitivity as well as long-term, she said. If somebody had an injury from a chemical, they can go on to develop what are called hypersensitive reactions later on. Did she believe it could develop into multiple chemical sensitivity? What I know about the pathophysiology of that, I believe that it can be. That you can go on and just have a general hypersensitivity from everything that I've read. But none of this mattered as a criterion for reentry. During a conference the next day, Leahy noted for Dr. Leda Koken that if a returning resident, quote, becomes hyper, odor, go to physician. Proviso, a bunch of people with obvious rashes or PFT changes. Info, come back to all consensus groups. The translation, if someone had a hypersensitivity to an odor upon returning, they should see their doctor. But if a, quote, bunch of people reported symptoms upon reentry, such as rashes or respiratory problems, then the consensus groups would consider that information. Leahy explained, it had to do with an individual response versus a larger group response. So if you had some individuals that may experience hypersensitivity, that in itself isn't a large public health issue that would allow you to sustain an emergency. How many individuals would it take? What was a bunch? And how would officials track such information? I don't know, Leahy said. I don't even know how many we had. Had there been someone saying, maybe we should sustain the emergency? Leahy, I'd been asking him, Sehested. I felt like, yes, there's this emergency phase, but there's also this follow-up, when people who have been injured continue to not feel well, and also concerned about possible exposure to something else. I just wanted some guidance on, even if we didn't sustain an emergency phase, who was going to do that follow-up? Was it going to be ATSTR? Was it going to be MRL? To what extent did the health department need to be involved? There wasn't an OSHA standard we could go by. This was not an occupational thing. There wasn't a threshold limit value, she said. Leahy acknowledged, I know that there are a lot of different opinions, that there's a lot of different research on chemical sensitivities. With the conference call, she said, even with those experts, they felt you can only look at chemical sensitivities, or what they called hypersensitivity, on an individual basis, at a highly specialized medical level, and that even then, that the literature sometimes conflicted. So in terms of getting general guidance on that, we couldn't. As for the possibility of migration of any chlorinated compounds in sensitivity, Leahy recalled, I was working with the EPA trying to get acceptable limits. We weren't able to obtain any, so there really wasn't a lot of clear data except one-on-one with a physician, and they don't always agree. We had lots of questions about hypersensitivity and not a lot of answers. No one thought the emergency should be sustained because of hypersensitivity. So Hasted gave the legal determination it could not. Yeah, she said, and we asked him to, because this was to discuss criteria for reentry. If you're going to let people go back in, then you probably don't have a situation in which you can sustain an emergency. A key question, hypersensitivity to what? Did it mean having reactions to the environment that had been originally contaminated? Or did it mean people could also now be sensitive to common chemicals at home? It's fair to say it could have been either one, she said. But even if the sensitivity was to a contaminated environment, Sehested advised they could not sustain an emergency. In sum, if some residents, less than a bunch, found it difficult or even impossible to return home because of hypersensitivity to the area, it was not a public health emergency. It's airway hyperreactivity, Weiss said, of hypersensitivity. You become sensitized to follow-up exposures. Your immune system becomes hypersensitive to not just the original chemical that caused the problem, but to other chemicals that irritate the immune system. It's typically the result of an acute exposure. You get a heavy-duty exposure and it causes a change in your immune system that causes your immune system to hyperreact to other assaults. Weiss recalled, we knew that people were hypersensitive. We were hearing reports not only from individuals, but also from physicians, indicating that they were observing some hypersensitivity, and they expected hypersensitivity. Once there's a reactive hypersensitivity formed, you're going to be reactively hypersensitive. It doesn't matter where you are. For example, evacuees could have newfound reactions to cats in Missoula, he said. Reactive hypersensitivity is triggered not only by the chemical that originally caused the sensitivity, but it can be caused by any other chemical, he said. We knew that was going to happen. Weiss said no one favored making hypersensitivity a criterion. Yeah, it wouldn't really have made sense to have to keep people out of their homes because of reactive hypersensitivity. Many residents would later disagree. Sunday, April 21. At 9 a.m., Leahy held the Key Health Conference with Jim Carlson and Peter Nielsen of the Health Department, local pulmonologist Dr. Paul Lunin, cardiologist Dr. Hel Braun of the Health Board, Administrator Chris Sigler of St. Patrick's Hospital, Dave Torgerson of Olympus, the EPA's Chris Weiss, and County Attorney Sehested, with others participating via conference call, including Todd Damrow of the State Health Department, toxicologists from the Rocky Mountain Poison and Drug Center, and an MRL contractor. The meeting was not documented, except for Leahy's highlight notes. Leahy noted 13 parts per million trichlorophenol in the air near tracks. Leahy recalled this semi-volatile organic compound air measurement as the only one that I remember, she said, likely from Olympus, who did not document the measurement. This signified that chlorinated compounds were still being released into the air at the site. Various smells were acknowledged besides chlorine. Leahy noted phenol and mercaptan smell and pesticide-like odors. A concern was, quote, cressolate odor and symptoms. Symptoms of delayed hypersensitivity, kids in pool, could also be triggered by other. Leahy noted that OSHA had 10-hour standards for some unidentified exposure, but she wrote, no information regarding residential extrapolation, but population reentering has been injured. OSHA standards were based on healthy adult workers. Officials did not know safe exposure for the general population, not to mention for people now hypersensitive. Any such standard would now have a lower threshold, a more serious consideration. Leahy noted per Dr. Lunin, a treating pulmonologist, quote, significant symptoms upon reentry, much psychological overlay, hard to dissect, reentry, headache, nausea, respiratory symptoms, cough, shortness of breath, chest pain. Small sample of patients in office. Those with problems have underlying problems. Some children have small airway obstruction. Lunin, who would later hire on as an MRL litigation witness, did not believe in multiple chemical sensitivity. Here he referenced psychological overlay and pre-existing conditions to help account for symptoms during reentry visits. For Dr. Bronstein, Leahy noted in listing criteria for reentry, odor will be a problem. For Chris Weiss, Leahy noted, Railroad will do indoor air monitoring prior to and during reentry per MRL consultant. Once again, the promise of indoor air monitoring. In this meeting, consensus statements emerged. First, the highway would be opened when chlorine levels were low and non-detectable on the highway, but some odor in zone, and when the chlorine cars were stable with little or no risk of catastrophic release. Second, concerning chlorinated compounds, conferees would wait for the sampling results. When they do come back, Leahy noted, even if a small amount, we'll have to extrapolate. By extrapolate, Leahy recalled, officials wanted to determine how small concentrations could affect people. What it ended up being was, she said, there was that one sample that showed something, 13 parts per million of trichlorophenol in the air near the tracks, but then there was nothing else. But there was still odor, you see, so that was real difficult. But it was mostly soil and wipe samples being taken, not air. The group would also hold on dioxin testing. Weiss didn't expect dioxin formation. Finally, they wanted the cresslate-contaminated soil optimally gone before reentry. If cresslate not gone, Leahy noted, reconsider reentry. The doctors concurred the bulk of cresslate should be removed from the site. The soil at the site was considered the source of the reported odor, Leahy recalled. That's why everybody wanted it out. Not to be forgotten, residents had complained of symptoms to these odors. The health group also discussed sensitivity issues. Lacking in Leahy's notes was any discussion of the expected duration of hypersensitivity symptoms. Leahy again noted, per County Attorney Sehested, they cannot sustain an exclusion on hypersensitivity. People can go in. Should be advised, may be hypersensitive. Teach to physicians. Sehested advised the legal opinion that hypersensitivity did not constitute a public health hazard that could continue the state of emergency and evacuation. Sehested also suggested that residents be advised about possible hypersensitivity reactions and that local physicians be taught about residents experiencing hypersensitivity. But Leahy claimed later that, quote, teach meant patients talking to the physicians about any hypersensitivity. That wasn't educate the physicians, he said. So people can go back in. If there are those that are hypersensitive, they can talk to their physicians. This was obvious advice that residents explain their symptoms to their doctors. There would be no official public health outreach to area doctors about hypersensitivity. Educating doctors would have been a good idea, according to the many residents who claim many doctors were skeptical, both about sensitivity to the post-spill environment and sensitivity symptoms in general. But Leahy said Sehested was not suggesting the health department talk to area doctors about sensitivity issues. No, she said. It became an individual matter versus a larger-scale population matter, Leahy reiterated. Sensitivity was not a public health concern. Individuals were on their own. Weiss, however, did recall an effort to work with local doctors. Weiss, we had assembled a team of physicians from the local area, understanding that they were the ones that were probably fielding questions from the patients and the public in general as people began to suffer symptoms of hyperreactivity or even more severe symptoms. We wanted to make sure that the physician community was aware of what we knew. In order to help me do that, I had a standing contract with the Rocky Mountain Poison and Drug Center out of Denver, which is one of the best poison control centers in the country, probably in the world. So local doctors could turn to a clinical toxicologist for better advice on clinical issues. Weiss said Leahy was very involved with this, being the director of the health department. She knew who the local docs were and knew the physicians that were fielding questions on this. So we did some outreach to them, including at least one, if not more, meetings with them face-to-face to make sure that they had several pieces of knowledge. What spilled, what are the chemicals, and what are the toxicological effects of those chemicals? Weiss said hypersensitivity and RADS were discussed with the doctors. They had all that information, he said. But apparently, the discussions did not involve very many local doctors. According to Weiss's notes, only one, Dr. Paul Lunin, a pulmonologist involved with spill patients at the onset, and who didn't believe in multiple chemical sensitivity. Leahy had also listed cardiologist Dr. Hal Braun as participating in the Sunday conference. Weiss said Leahy made the local contacts, acknowledging that not too many local doctors were involved. Most of these guys were really busy, he said. Was it the idea from this conference that some local doctors and health officials, armed with information about hypersensitivity, would somehow disseminate the information to the broader medical community so everybody would have a heads up in case they saw an Alberton patient? I believe Ellen was in contact with many, if not all, physicians in the county and was doing that outreach based upon information that we were generating, he said. But as for the result of any outreach, Weiss also said, I think that was probably more the case where Dr. Lunin was the spokesperson for the other docs in the hospital and played that role to share that information. Additionally, we funded and encouraged people to contact the Poison Center directly and get whatever help they needed or answers to their questions. In this lower tech era, Weiss wasn't sure if the advisories the Poison Control Center faxed to Leahy made their way to local doctors. Poison Control would have left it up to the local health department how to share the information, including with the media. Regardless, the Rocky Mountain Center did not issue an advisory on hypersensitivity. Lunin, according to Weiss in the logs, was a point man for local outreach, but any outreach about chronic issues such as hypersensitivity did not ring a bell with him. I don't recall that I had a discussion with an EPA toxicologist about long-term effects, Lunin said later. Many Alberton spill victims would later say that one of the obstacles they faced was getting doctors to recognize various hypersensitivity symptoms as being related to the spill. It would be left to sensitized spill victims, indeed, to teach their doctors. At the end of the conference call, the health group had a consensus on 4 issues that became the criteria for reentry. 1. If chlorine was stable, open the highway. 2. If chlorinated compounds migration was negative off-site, allow reentry. If positive, confer. 3. The bulk removed of the contaminated soil. Reconvene health experts if, quote, many people had symptoms upon reentry. Presumably, the experts thought soil odor caused symptoms. And 4. Identify the white dust as not being harmful. This conference made clear that health specialists generally acknowledged that the potassium cresylate odor caused symptoms, that a cresylate component or chlorinated compound smelled pesticide-like, that individuals could have become hypersensitive, and that some residents had been having symptoms upon visiting, including nausea, headache, chest pain, cough, and shortness of breath. Despite this, conferees came to the consensus that medically, and therefore legally, hypersensitivity could not be a criterion for stalling reentry. Officials knew that returning to the Alberton area made some residents sick. That sickness, however, was not considered a public health threat. Meanwhile, there didn't appear to be any systematic or broad attempt to advise local doctors about hypersensitivity issues related to the Alberton spill, nor was this issue publicized in local media. But in order for affected residents to teach their physicians about hypersensitivity, the residents would have to understand it first. Everybody signed off on that, Leahy said, this criteria and how we were going to meet it, and then we took it to Incident Command. At a noon IC meeting, Leahy reported on the morning's conference call and the 4 criteria. In anticipation of the upcoming reentry, Waldron said, the briefing before reentry should be limited to Alberton residents only. Leahy, has to be a public meeting. Waldron wanted to exclude activist outsiders. At the afternoon evacuee meeting, officials reasserted attempts to limit public discussion. The new facilitator was Dixie Dees of the Forest Service, who served as a coach for the Incident Command System. With snapping chewing gum and a high, soft voice, Dees was no nonsense. Dees, today we're going to try a little different format. We'll have all of the speakers at the table give the information that they have, and then hold questions until afterwards. And all the speakers will be at a place in the room so that you can talk to them. And eventually, we're going to see how that works. If it doesn't work, we'll go back and try something else tomorrow. We've been getting a lot of questions from people. If you could put your name and address on those so that we can be sure you get the information back, that'll help us a lot and help you. The intent, again, was to allow no general public Q&A during the meeting. Sergeant Dave Ball announced that the resident animal feed was back on for tomorrow morning, reflecting the consensus that migration of compounds was unlikely. Leahy presented her reentry allowable criteria flowchart: stable chlorine gas, no migration or a safe level of chlorinated compounds, the bulk of the contaminated soil removed, and identification of the white dust as safe. Of the potassium crestlate contaminated soil, Leahy reminded, that is the liquid that has the phenols in it and things that can smell, the mercaptans. Leahy did not mention a pesticide smell. So the odor threshold for that is very, very, very low, she said, and some people might get headaches from it, and so on and so forth. And so in consulting with our specialist this morning, we all felt that we'd like to get the bulk of that particular chemical off-site. And if the answer is no, we haven't satisfied that criteria for reentry. Other than headaches and, quote, so on and so forth, Leahy omitted mentioning other reported symptoms, hypersensitivity per se, and that the consensus group would reconvene if a, quote, bunch of people had health problems. This would have been a very good time to address hypersensitivity and explain why it was not a criterion for reentry. If all 4 criteria were satisfied, reentry could occur, she said. Safe reentry required no significant exposure to residents from the contaminated area, which is why Plateau Road residents might have to wait longer. Officials didn't address why these criteria had not been applied to areas already reopened, as well as to the repeated visitations. After a presentation from Dave Torgerson of Olympus, Deputy Susan Hintz of the Health and Human Resources Group answered some questions asked yesterday. Then Dixie Dees wrapped up. So with that, each of the people that are up here will be down on the floor, and the next meeting will be tomorrow, same time, same place. A woman in the audience: I have some questions. Dees paused, then ignored her, snapping her chewing gum. Thank you, she said. But a hotel microphone was already set up back of the room and turned on, with a resident waiting. A young woman who had asked this question at an earlier meeting said, yes, I was wondering how the criteria was developed for the access into the previously evacuated zones. Dees: okay, who can answer that up here, and where will you be on the floor? Okay, you want to come up and see Ellen, please. Thank you. The question would not be answered publicly. The uncomfortable answer was that the new criteria had not even been developed for the partial reentry and the almost daily visits. With this dismissal, the 36-minute meeting broke up. Amid loud chatter, someone nearby Will Snodgrass' camera spoke of frustration, saying, because people want to ask questions in front of a crowd. Through open discourse, spill victims found out that others had similar problems, that there was a public concern. As for the length of meetings, they needed to last as long as was necessary to air all concerns. Public complaints had largely driven the health and testing response from officials. One woman with a question today made an entry about it in her diary. She wrote, when it was time for open questions, the group was told to break up and express your questions or concerns to each designated person privately. I spoke to the MRL representative. I told him I was scared to go back. I didn't feel right putting my kids back into such a contaminated area. I had health problems from the first dose and was fearful of adding to that. He immediately referred me to another man from MRL. This man, likely a claims agent, repeatedly told this resident that everything should, quote, probably be all right. After she explained her concerns about the safety of returning and her family's health issues, she wrote, he then stated that I should see a doctor. When I told him I already have, he said to me my symptoms were probably due to excess fear and stress, and that I should seek counseling for my fears. He also said that any health problems I'm having now were most likely pre-existing problems I had before the spill. Just by chance, they had a mental health station set up in another room. The conversation pretty much went downhill from there. I was offended at his implications and knew I had come to the wrong place for help and understanding. For this woman, the effect of this private consultation was to plant in her head the notion that she had no real health claims related to the spill. The conflict of interest in having MRL, likely a claims agent, answer one-on-one questions was obvious. While some residents expressed outrage at lawyers outside of meetings trying to find clients, MRL, with the blessing of the panel, conducted one-on-one help sessions that influenced MRL's liability. No sooner had Leahy announced the 4 criteria than she received blowback from the EPA's Steve Way, who was concerned about removal of the bulk of the soil. First, Waldron and Way met that afternoon, as IC summarized. Way: the health department had developed the criteria for the allowable reentry into Alberton. My understanding was that they were addressing health issues only, not operational issues. Way explained that they cannot just remove the soil from the site. The soil has to be tested to determine the level of hazards. The decision would then be made as to the disposal. There was no basis for the health department to make the decision that the bulk of the product had to be removed before reentry was allowed. Way said he was the only authorized person to decide the question of soil removal and was unable to understand the health department's involvement in an environmental issue. Way didn't see how the smell from the soil was a public health issue, and this included sensitivity reactions. His toxicologist, Weiss, had already acknowledged hypersensitivity. Way: it was my understanding that the soil would be removed from the contaminated area, placed on plastic, burned, and covered with plastic. It is possible to load the soil in a roll-off dumpster and store it at the site. Way emphatically concluded, I will stake my career on it that this soil poses no health threat to Alberton. Soon after, Waldron, Way, and Leahy met. Way began. The plan with the MRL contractors was to excavate the contaminated soil, to use caustic soda to neutralize the chlorine and acid. The soil was to be segregated into chlorine, caustic, and mixed compound contaminated soils, which would entail testing. There is a logical, manageable approach, he said. Some material is not hazardous waste. Some material is a hazard, and we will need to find a place to put it. In reference to removal of the soil, I did not think tying re-entry with the soil. I cannot buy into that. Leahy replied, there was a 2-hour meeting Sunday morning. The decision was made to contain the odor and move some of the soil out, get the bulk out. The toxicologists, including Weiss, feel there are true symptoms from the odor: nausea, headache. Waldron: the public was left with the impression the soil was to be removed from the site. We need to manage what's been said. Way was only concerned that any clinical threshold for health effects was met for air and soil. The numbers. If Way had suffered from hypersensitivity, he may have had a different perspective. Removal seemed to be what the public wanted, at least those residents complaining of smells and reactions upon visiting. Leahy said the clinical threshold to health effects are there due to odor. Leahy: all the clinicians and toxicologists said the symptoms are real. She wanted the bulk of the product removed from the site of the spill and treated. Way: our plan was to excavate the soil and mix in the soda ash, monitor the soil. If it continues to off-gas with hydrochloride, we'll keep adding soda ash. The mercaptan smell has more to do with temperatures. But cressolate-related smells concern more than mercaptans. MRL could legally store the soil in a rail car on a rail siding close to the site, Way said, but only with approval from the state. Leahy said Montana DEQ's Solid and Hazardous Waste Division are difficult to work with. Way: I will assist in the excavation. If they want to move the product to a rail car, I will assist in getting approval. For reasons undocumented, the rail car storage plan was not used. Leahy concluded with, the public will want to comment. In the end, Waldron, Leahy, and Way agreed that the soil would be excavated, treated to control odor and acidity of the soil, and covered on site. Residents could return prior to final removal of the soil off-site. It was a tough meeting. It was hot, Leahy recalled. Steve Way and I were having a serious, very frank debate at that point. Had Leahy thought the soil posed a health threat to residents? I wanted to get rid of it, she said, and I had just come out of a very lengthy and well-informed teleconference where all the experts agreed it needed to be gotten rid of. Regardless of what his opinion was, we had garnered an opinion of a number of experts, including his own medical toxicologist in the EPA. The reason he was part angry was the communication hadn't reached him. But the meaningful dispute was over the contaminated soil. Leahy and the experts agreed, quote, the symptoms are real from the odor. But Way got his way. Way didn't get his way, Leahy protested. But the soil was not removed. It was removed from the site, she said. It was staged on site. Well, the staged on site I had a problem with. I agree. But that was the point. The soil was removed to a nearby spot on site. In fact, the excavation and staging of soil would vastly increase the surface area of exposed contamination. though the soil was supposed to be covered and treated for chlorine odor. Way simply claimed the soil was not a health concern. Leahy's intent had been for outright removal from the site. "Oh yeah," she said, "to get it out of there. But I will admit that none of us ever thought, where's it going to go?" Way's main point that he staked his career on was that the soil posed no health threat, which Leahy and others didn't agree with. The symptoms are real. Sensitivity made the symptoms very real. In his final report, Way wrote, "Phenols, cresols, and chlorinated reaction products are in the soil which was excavated, placed on plastic liners, and covered to minimize off-gassing of nuisance vapors." Did Way think the soil posed no health threat whatsoever, or didn't as long as a person was a certain distance away? Way: "We certainly had no basis to suggest quantitatively that there was any reason to believe that these people were exposed to anything," he said. "And you can't measure it. The fact that people were smelling things that caused them to react potentially physiologically is certainly possible. People have different sensitivities. People get exposed to things. People's sensitivity to that odor now increases. And your olfactory system, particularly related to chlorine and related compounds, is very sensitive, below thresholds for harm." So now take that into the context of a pile of soil that is, let's say, on the order of half a mile at least away from any of the residents in Alberton. And to tell people they can't go home because that's still sitting there, in our judgment, was not defensible. But the threshold to harm had also been lowered for those sensitized. Weiss originally approved the soil removal criterion during the meeting with Leahy. "The original proposal by the health department," he said, "which we supported, was to have the soils removed before reentry. We knew from the handheld monitoring that we had that the off-gassing from the soils, although you could smell it, was below any criteria that we could use to enforce further evacuation, and we knew that it was going to take time to test those soils. So there was a compromise made, and that was to cover the soils with tarp to minimize off-gassing and odors, and reopen the road and bring people back into their homes. I think it did not compromise health in ways that weren't already compromised. The hypersensitivity issues were going to be there whether the soils were removed that day or 2 weeks from then. Once the chlorine was gone," Weiss said, "the mixture products and the remaining cressolate was a chronic or long-term exposure issue. But did they need to be removed today, tomorrow, in order to alleviate an acute or short-term threat? No, they really didn't. They were annoying. They were odorous." But this suggested that the soil criterion, where all the experts agreed it needed to be gotten rid of, as Leahy said, was essentially unnecessary. Weiss: "Was it a nuisance? Did it smell? Yes. Did it smell worse than new railroad ties being brought in and set in the hot sun? Not really." At the same time, he acknowledged that covering the soil in tarps wasn't perfect. "I'm sure they slowed the off-gassing of the volatiles from the pile, but they would not have been impermeable to odors. In fact, some of those materials probably would have gone right through the tarp," Weiss said. The policy change wouldn't be difficult to pass off because the reasons for wanting the soil removed had been downplayed publicly. Leahy had made reference to mercaptan smells, but nothing about the pesticide-like smells. "And some people might get headaches from it, and so on and so forth," she had told residents, making no reference to respiratory problems or hypersensitivity per se. After much ado, the soil odor was ultimately considered a mere nuisance, as Way wrote. Hypersensitivity was not a criterion for stalling reentry. Hypersensitivity was not even publicly discussed, much less taught. Next time on Gas, the true story of a toxic train derailment. The techs struggle again and again to patch the leaking chlorine car, even as a big spike causes forward ops to evacuate. Meanwhile, officials at the evacuee meetings hold a vote on whether to allow public questions. Until then, this is Ron Scholl. Thanks for listening. This podcast is adapted from the book Gas, the true story of a toxic train derailment. Visit Amazon.com to see the 2-book series. To access support material in the book, such as maps, photos, illustrations, and video links, visit my Facebook page Gas, the true story, or watch my Gas playlist on my YouTube channel at RL Scholl.